morning. How are you today? I hope you can hear us, and do tell us where you're watching us from. And the topic today is very short. You'll be shocked how short it is. It's a very short discussion. We received a lot of requests from yourselves, and we were overwhelmed with just one question. Okay, one question. Doctor, explain what a hernia is. Doctor, what is a hernia? And so we thought, okay, fine, since people want to know what a hernia is, and we thought, okay, let's take advantage of this opportunity to bring knowledge to the fore. And so at the end of this conversation, one of the things we expect you to be aware of is what a hernia is, the different types of hernias, in which populations do you find different types of hernias, what causes a hernia, what are the risk factors, is it dangerous? Is a hernia treatable? Now, at the end of this conversation, these are questions that we hope will have been answered, and this is the pieces of information we hope you will have gained, and next time you hear some of these things, you will be able to approach them with confidence and with knowledge. And what is even more important is that whatever knowledge you acquire from here, if it's useful, please share. All right? Whatever is useful, whatever is of benefit, whatever is praiseworthy, share. Share with your loved ones, share with your friends. All right? Let's begin. Hernia is a Latin word. Okay? Hernia is a Latin word. Now, hernia, when you hear the word hernia or herniation, or something has herniated, it means that this is a body part, usually an internal body part, that has left or that has protruded out of its normal sac or its normal positioning. Okay? So when you hear that an organ of the body has herniated, it means that that particular organ of the body has protruded through and out of its normal sac. So meaning that body organs are contained in specific positions and specific sacs. Now, usually you will find that hernias are usually, most of the time, abdominal. Okay? Majority of the hernias you will find are generally abdominal. So when you really study the hernias, you'll find that hernias, you'll find that between your chest or just under your diaphragm and all the way to your waist. That's where most of the hernias will occur. And depending on age as well. So some hernias, we see them mainly in certain age groups. Some hernias, we see them mainly in certain sex, either male or female. Some hernias are more common in women. Some hernias are more common in men. Just bear that in mind. Now, let's go through the hernias one by one. There's a very important hernia that happens just around your diaphragm, the space where the food pipe enters the chest or passes through the chest. You have a sheet of muscle. It's a flat sheet of muscle called the diaphragm. Now that flat sheet of muscle has a weakness through which your food pipe passes. And sometimes your stomach can actually push through that opening, and your stomach is found goes into your chest where your lungs are. That's called a hiatus hernia or or diaphragmatic hernia in medical language. Now, for a hernia to happen anywhere in the body, there are a few factors that need to be in place. First of all, there needs to be a weakness in the wall that protects the organs. And that weakness could either be a weakness that you were born with, or a weakness that was naturally there due to anatomic development, or a weakness that was artificially created either through surgery. Given that weakness, for a hernia to happen, for the organ to go through that weakness, there has to be pressure. So there has to be pressure in that space to push out the organ that has been affected. So in this particular instance, for the stomach to go through that space into your chest or into where your lungs are, okay, there must have been pressure building up in the stomach, building up in the abdomen, and push the stomach up, out into either a portion of the stomach, sometimes even all of it, even some intestines can even go into your chest wall, where you have intestines together with the lungs. Sometimes we've seen intestines in the sac where you have the heart. Around the heart, there are intestines there. That has happened before. Rare, but it has happened. So that's one type of hernia. The other type of hernia is called umbilical hernia. Now, umbilical hernia, as you may hear from the name, it happens around your navel. And because the muscles around your navel are not very strong, okay, if there's any pressure building up in the stomach or in the abdomen, you'll find that intestines, a piece of it or fatty tissue will protrude into the navel. This is where you find children who have a very large umbilical area. Okay? Chimchombo chikuru so mwana. That's a hernia. Now, usually umbilical hernias happen in children, in babies. That's why you find a lot of umbilical hernias. You can see it in an adult once in a while, or especially the elderly, even sometimes people who lift weights, who don't know how to lift weights properly. That's why when you're lifting a weight, you should be very careful. You can actually get a hernia. But commonly speaking, umbilical hernias, we see them in children. So you find the children who have a very big umutoto, like that, mchombo ukuru mwana like that, okay, a very big nerve protruding outwards. That's an umbilical hernia, mainly in children. The other type of hernia you will find, this is a type of hernia which is called incisional hernia. Now, incisional hernia is where somebody had surgery on the abdomen and maybe didn't heal properly, and through that same weakness, which did not heal properly on the abdomen after surgery, the intestines can actually protrude out, especially if you build pressure in the abdomen. It's called incisional hernia. All right? It's called incisional hernia. Usually you see that in maybe women who've undergone cesarean section, or somebody who's very obese and had surgery, and the doctors were advising you to exercise, and because of poor healing, you were just sitting at home and you were not really exercising your muscles properly. So the healing wasn't very strong. So there's a weakness in that region. And when you build up pressure in the abdomen, intestines protrude out and you get what we call an incisional hernia. Incisional because the incision is where the doctor cut in the abdomen. That is what we call an incision. The other type of hernia you will find, this one usually happens in women. Women who are pregnant, especially pregnant women, either women who are overweight, you find what we call a femoral hernia. Now let me explain. Don't be afraid of the words. Femoral hernia happens because, you see, when there's a very huge pipe or artery and vein, they move together like this, and they are very big, that carry blood into your leg and away from your leg as well. So the artery takes blood to your leg, and then the vein takes blood away from your leg up. What happens there is that the portion where the big artery enters the abdomen and the portion where the big vein comes out of the abdomen, there's a weakness in the muscle. So when a woman is pregnant, organs get pushed down, and then you find that organs protrude through that same opening into the leg. So you find an intestine in the leg. Okay? We find intestines protruding into the thigh, or a piece of fat, or a piece of a portion of an organ in the abdomen protruding into the leg. And you see this commonly in pregnant women, or women who are very obese, or women who have very large fibroids, like you have a very huge fibroid. You have what we call a femoral hernia. Okay? Another type of hernia is called the inguinal hernia, or others commonly call it the scrotal hernia. But scrotal is very colloquial, as it were, so doctors don't use such words. In medical language, we call it an inguinal hernia or inguinal hernia, depending on who taught you English. So, inguinal hernia or inguinal hernia happens in this fashion, and it only happens in men. Okay? Inguinal hernia only happens in men. It doesn't happen in women. The reason it only happens in men is because men, we are the only ones who have what we call the spermatic cord. And that spermatic cord, remember that the tube that carries sperm and all these things goes into the abdomen first and then comes out. That's why you find that when children are born, especially boy children, you should pay attention. Our testicles sit in the abdomen and they start coming down bit by bit until they reach the scrotum. So the testicles of a boy child sit in the abdomen and they keep coming down. That is why if you have a boy child as a parent, please check that both testicles have actually come down and they're in the scrotum. Because there's something which is called undescended testis. Undescended testis is because the testicles have remained in the abdomen, and that can cause cancer and infertility. Now, as the testicles are coming down, the pathway them follow where the testicles are passing, there's a space that remains there. Because the testicles are coming down together with everything it has. All the blood vessels, the tubes that carry sperm and everything, the testicles come with it all the way from the abdomen coming downwards into the scrotum. This is how testicles come down for all men. And because this process does not happen in women, women can never get an inguinal hernia or a scrotal hernia. It only happens in men. Now, how does that happen? Remember I told you that for a hernia to happen, two conditions must arise. You must fulfill two conditions for a hernia to take place. There has to be an organ in a sac whose sac has a weakness somewhere. Okay? And in that sac, there has to be pressure for the organ to be pushed out through the weakness of the wall. So because as the testicles are coming down, they create a weakness in the muscle. They create a weakness in the wall that covers your abdomen. There, where it passes, it even creates a channel called the inguinal canal. When you create pressure in the abdomen, your intestines can come through that hole, okay, and come out. And you see it around your groin. You see a swelling around your groin initially. And the swelling can, if it's inguinal, The intestines can even go down into your scrotum. Probably that's why people call it scrotal hernia. That's why, but it's colloquial really. In medical language, we don't call it scrotal hernia. It's still an inguinal hernia, but the intestines can go all the way down into the scrotum, as it were. But it's still an inguinal hernia. Now, that happens in men. And any man out there has that weakness, including myself. Now, how do you increase the risk for hernia? Is when you are lifting heavy objects. That's why I find that some people, they tie a huge belt around their waist in the gym because they want to hold everything together. Because if they don't, things there can become weak and you end up with a hernia. So there's even a technique of how you lift heavy objects. Okay? The other thing that can build up pressure in your abdomen to the point of having a hernia is if you have a chronic cough. Or you are bearing down a lot, either due to excessive diarrhea, you can have a hernia sometimes. Okay? Those are some of the things you have to worry about with regards to hernia. Now, is a hernia dangerous? Can it kill you? All right, let's explain. Ideally, a hernia can either be reducible or irreducible. A reducible hernia is one where the organ, yes, has protruded out of its space, but you can actually push it back. You can push it back. So that's a reducible hernia. A reducible hernia, you can reduce it back. A hernia where the organs cannot be pushed back is called an incarcerated hernia. Incarcerated because it's held back. Now, an incarcerated hernia becomes even a bigger problem because it can complicate into serious problems. So depending on what organ has protruded and become incarcerated where it is, it can cause what we call intestinal obstruction. It can cause intestinal obstruction. And intestinal obstruction, this is where you are eating, but you're not going to the toilet. And intestinal obstruction is an emergency. The other reason we worry about hernia sometimes is because the other complication is where once the organ has protruded through that tiny space, because the space is very small, the hernia can become what we call strangulated. To strangulate is like someone, and the hernia can get strangulated like that. And if it gets strangulated or squeezed like that, then blood supply to the end of the hernia becomes compromised, and to the end of that organ becomes compromised, and if it's an intestine, it begins to die and can cause problems. And that is a serious medical emergency. That's why your doctors worry about hernia. That's why you should be concerned about hernia, because anybody can get a hernia. Yourself, myself, and anyone. Do you know why all of us can get a hernia? It's because these bodily weaknesses that we have are made by nature. They are natural weaknesses in our body makeup. And depending on the risks that you have, because remember, these things have risks, all right? These things have risks. What have I done? These things have risks, okay? They do have risks. And some of the risks that you need to worry about. Who is likely to get a hernia? So that's why you need to worry about the risks. If you smoke, for example. Why is somebody who is smoking, who smokes heavily, likely to have a hernia? Is because you cough. You end up coughing a piece of intestine out of its place. That's why we always discourage you from smoking on this stage. The other issue is, we mentioned it earlier. Remember when we said that femoral hernia is very common in women? Pregnancy. So a woman who is pregnant is very likely to get a hernia. And usually you find that hernias in women can be confused with other things. For example, it's very easy to confuse a hernia in a woman with an ovarian cyst. It's very easy to confuse a hernia in a woman with fibroids because there's a lump there. So when you're touching as a doctor, you feel a lump. So it's very easy to confuse it with fibroids or a cyst, or even endometriosis. Very difficult, very easy to confuse a hernia in a woman with endometriosis. So just be very careful. This is for healthcare workers who are listening. The other risk that you need to worry about that predisposes you to hernia is obesity, being overweight. So if you are overweight, you are likely to get a hernia. All right? You are likely to get one. So those are things to look out for. Yeah. The other issue we talked about that may cause predispose you to hernia is previous surgery. Remember we talked about incisional hernia? So people who've had surgery on their abdomen of any kind, they are, predisposed to such things, especially if the healing wasn't very good. If the healing wasn't very strong, they may end up with the incisional hernia. So bear that in mind. The other issue is, for example, if you're having dialysis, especially peritoneal dialysis, because in peritoneal dialysis, they perforate your abdomen to push the pipes inside your abdomen for dialysis. And after they are done, sometimes you can get a hernia in that space as well. So that's how hernias happen. Is hernia treatable? Yes. A hernia is treatable. Okay? A hernia is treatable. How do you treat a hernia? Surgery. Surgery. So what your doctor will do, they'll go and repair the weakness in that wall. So they can go and take those sutures, tighten the area that has a problem, tie it up. If they don't have sutures, another way they can do it is put a mesh there like a chigamba. Okay? The way you tie ifigamba, the way we used to tie ifigamba in the compounds, they'll go and put a chigamba where there's a problem and, tie it up nicely. And that's how you repair a hernia. So how long does surgery for a hernia take? 30 minutes. Yeah. In good hands, about 30 minutes, the doctor is finished. 45 minutes if they delay. So it's that simple. But if left untreated, if left unchecked, yes, it can cause you problems. And the biggest problem it will cause is the problems I've talked about, where your organs become strangulated, or the affected organ becomes incarcerated, or causing intestinal obstruction if it's an intestine which is involved. So look out for hernias, especially in children who have a big muchombo, mtoto ukulu so mwana. Such children, please pay attention. Okay, if you have a child who has such a thing, please take them to the doctor. Let them go and check what is inside. If it's an intestine, they can fix it. Don't let the child walk around with such a problem. Yeah. And also, if you are pregnant, please pay attention. Okay? And the message for all of us is that a hernia, we are all vulnerable, including myself, including yourself. If it's inguinal hernia or scrotal hernia, every man you see walking around is vulnerable to inguinal or scrotal hernia because of the things we do. Sometimes our technique for lifting heavy objects is poor. You get a hernia. Even as I'm talking today, one of you listening to this, if you go and lift a heavy object using a wrong technique, you get a scrotal hernia. So just bear that in mind, that we are all vulnerable purely because of the way God created us. All right? And also here's the other thing. Hernia is very common. It's a very, 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 very common condition. Extremely common. Go into any hospital right now, or go into your nearest hospital right now, go into their surgical department and ask them how many hernias they repaired in the last 1 week. It's plenty. It's what we were doing in medical school. Plenty. So it's not a very mysterious illness. There is nothing complicated about it, but it can get complicated. And that's why we worry about it when we see it, and that's why we treat it as quickly as we find it. So, this has been Dr. Mujajati responding to a very specific question from a lot of you this time. It wasn't just one person. A lot of you wanted me to explain hernia, and I hope now you have understood what hernia is, and I hope now it's very clear to everybody what a hernia is and how to avoid it, especially for men. And I hope that you will also share this knowledge. And as usual, like we do here, do share this video. Spread the word. We need to have as many of us as possible in Zambia making informed choices. Remember this: wear a mask in public, avoid crowds, and observe social distancing. COVID is real. That said, this has been Dr. Mujajati for Health and Prosperous Citizens. Enjoy the rest of your day. I might just come back with another topic. You never know.